Hi, I'm Jake Doré. Tonight, we'll be taking you on a journey through some of man's deepest fears. However, man's idea of what is scary is not just limited to ghosts and ghouls. In fact, what you fear may be lurking at your work, outside your door, or even in the room you're sitting in right now. What some people see as scary may be overlooked by millions of people. An unreasonable fear of an object or situation that poses very little threat is called a phobia. Let's take a look at what phobias are, what types of phobias there are, and how to overcome this psychiatric disability. Welcome to Phobias. Everyone feels nervous or troubled every once in a while. Things like your first day on a new job, planning for a long trip, going to the dentist, all can set off edginess. Sweaty palms, shaky sensations, and a pounding heart tag along this feeling of apprehension. Some anxiety helps keep you focused. However, cases of anxiety can be so serious that it interferes with work, leads to avoiding certain situations, or makes it difficult to enjoy life.
Hey, great mixer, huh?
Yeah, what a terrific idea. You know, we're all here, we all have our own phobias, but we can get together, meet each other, and not feel so alone for once.
Yeah. What's your phobia?
Oh, I have this unexplainable fear of apologies.
Sorry?
Ah!
What?
I just told you I have this unexplainable fear of apologies.
Oh!
What?
I'm terrified of repetition.
Terrified of repetition?
Hey, great mixer, huh? Sorry. No screaming. I have a fear of the word which is spelled A-A-G-H exclamation point. That word.
I'm apologies.
Repetition. Hello.
How? I mean, hi.
Good evening.
Ahoy there!
When fears are irrational and disabling, they are called phobias. A phobia is an overwhelming and unreasonable fear of an object or situation that poses little real danger. Unlike the brief anxiety most people feel when they give a speech or take a test, phobias are long-lasting, cause intense physical and psychological distress, and can affect your ability to function normally in social settings. However, phobias are not just a case of stress. You can't overcome them through sheer willpower, nor can the symptoms be ignored. These disorders cause you to feel fretful most of the time, making everyday situations so uncomfortable that you may avoid them entirely. Or, in extreme cases, there is the possibility of being immobilized with fear. There are three main groups of phobias, which include specific phobias, social phobias, and agoraphobia. Specific phobias are the most common, and they tend to focus on specific objects. These include a fear of enclosed spaces, animals, water, flying, dentists, tunnels, and many others.
But I'm not talking about commonplace boring fears like spiders,
heights, spontaneous combustion, or even spiders falling from great heights in flames.
Social phobias cause extreme anxiety in social or public situations. More than just shyness, social phobia involves a combination of excessive self-consciousness, a fear of public scrutiny or humiliation in common social situations, and a fear of negative evaluation by others. Agoraphobia is the fear of being alone in public places from which there is no easy escape. Most people who have agoraphobia develop it after having one or more panic attacks. Agoraphobia is a fear of a place, such as a mall, an elevator, or a room full of people, with no easy means of escape if a panic attack should occur. No matter what type of phobia you have, the following reactions tend to happen. A feeling of uncontrollable anxiety when you're exposed to the source of your fear. A feeling that you must do everything possible to avoid what you fear. The inability to function normally because of your anxiety. Often, the knowledge of your fears are unreasonable or exaggerated, but feeling powerless to control them. Physical, as well as psychological reactions, including sweating, rapid heartbeat, difficulty breathing, a feeling of panic, and intense anxiety. In some cases, just thinking about what you fear causes anxiety. Little is known about the actual cause of phobias. However, studies seem to show a strong correlation between your own phobias and the phobias of your parents. Children tend to learn phobias by observing a family member's phobic reaction to an object or situation.
Take your hat and hold it up in the air like this for me, all right? Just take it, hold it up, just hold it up, okay? Good. What's your fear? What's your fear? Tell me.
Spiders.
Lower your hand, lower your hand. Everybody think of your phobia, think of your phobia. Look inside the hat, look inside the hat, look inside the hat.
Phobias are the most common mental disorder in the United States. Although some phobias seem to have a genetic component, it's often impossible to know who will develop them. These factors, however, may increase your risk. Your age. Social phobia usually develops early in life, most often between the ages of 11 and 15, and almost never after the age of 25. Specific phobias having to do with the environment or personal injury also first appear in childhood, as early as the age of 5. Fear of tunnels, elevators, bridges, flying, driving, and other situational phobias usually develop by the mid-20s. Your sex. Phobias affect both sexes, but women are twice as likely as to have social phobia as men are. Women are also more likely as to be diagnosed with agoraphobia, but this may be because men tend to hide anxiety or mask it with alcohol. Men are also less likely to seek help for emotional problems than women are. Your family. If someone in your immediate family has a specific phobia, such as a fear of spiders or snakes, you're most likely to develop it too. Phobias tend to create even more problems later on. These include social isolation, where if you have a phobia, you may find that you avoid social situations and public places. Financial, professional, and interpersonal problems often result from social phobia and agoraphobia. Depression. The avoidance of many activities that other people find enjoyable in their personal and professional lives may lead you to become depressed. There are no laboratory tests for phobias. Instead, the diagnosis is based on thorough clinical interview and rigorous diagnostic guidelines. Your doctor will ask questions about your symptoms and take a medical, psychiatric, and social history.